Why is such a doubt? Eyes are only a small part of the human body. So, eye is not an exception for the general theory. Body is made up of, I have already told, body is made up of sapta dhadus, that means 7 dhadus, and the functioning factors are Vata, Pitta and Kabha. This is as such applicable in the case of eye also, no difference. But the thing is that in the case of the we know eye is the most important sense organ, and being in sense organs, the signs and symptoms cannot be identified easily, because the symptoms of these eye diseases are mainly purely subjective. So, it is very difficult to get the actual picture, because suppose a patient is saying there is floaters in his eyes. Floaters means a small moving objects like that the patient is experiencing. The doctors cannot see, and if the patient says there is floaters, the doctor is believing there is floaters. Got it? Or he is saying there is flashes. Flashes means like just like a feeling of light rays in front of his eyes. It cannot be detected. It cannot be examined by objective parameters. It cannot be evaluated because we have to depend on the subjective level symptoms. This is in Ayurveda, the subjective symptoms are more important. Just to see the not only detect, not even able to measure these symptoms. In spite of all the modern technologies, you just see even pain is not measurable now. And because it varies on tolerance level even. If I am saying I have pain here, that may not be the depth of that pain in another person. So, evaluation is different. So, again comes to subjective level, because we have to depend on that particular person, his nature, his tolerance, his body, his reaction. So many things are to be considered before starting a treatment. And this aspect is important in Ayurvedic approach. And this is more important in the case of sense organs. In other structures, we can ask them to walk, then we can see whether he is able to walk or not. But like that, we cannot understand whether there is floaters in his eyes or whether there is flashes in his eyes, or a patient is saying and this is not, this side eye is not visible. Then we have to depend on his words. Even in examination level, we have to depend on his words. But so many things are detectable by using so many equipments and so many instruments like that. But many of the symptoms are even beyond the capacity of most modern equipments. There we have to take our own expertise and experience and a theoretical basis that we are applying we have to apply this in a practice.